X-rays. Some people are worried. The X-ray dose is very small, but some people just don't want to do it. Well, there's another way of doing it, which is ultrasound of the neck. The neck artery is very big, it's very superficial, just underneath the skin, and it's also a very important artery. If you have blocked there, you get stroke. But the point is that it is very easily seen by ultrasound. So we can take an ultrasound image, and this is what it looks like, and we can measure whether there's cholesterol deposits. And the usefulness of this is that it also takes 5 minutes to do, put some gel. Ultrasound is safe even for babies, and so it's a good screening tool. And it kind of tells us what's happening in the body. It's not directly looking at the heart, but if your arteries in your neck are awful, chances are there'll be awful stuff going in your heart as well. So these are the professional people. It's not just my opinion, but there's this whole bunch of professional guys in the US who are now raging an ongoing battle against traditional approaches. And they basically say that we should screen people who are not just here, but the whole regime of people. And what they are advocating is that as long as you're a man over 45, doesn't matter what your risk is, or you're a woman over 55, you should either have an ultrasound done or a coronary calcium scan by the CAT scan done, the two things I mentioned. And if you have evidence of cholesterol deposits, start medicine sooner rather than later. These are some examples from my patients. This is actually my uncle. He's given me permission to use the slides. So every year he goes for a treadmill, and it's normal every year, so he says, I'm not worried. And then one day we decided to do an ultrasound of the neck. You see this thing, it's not meant to be there. This is a huge cholesterol deposit. You see this calcium and it's sticking out of the artery. I mean, you do not want to have an artery that looks like this. Okay? And in fact, the treadmill was read wrongly for a long time because he does have disease, but fortunately his heart disease is not that severe. That's why he has no symptoms. But this is a guy that's going to be headed towards trouble. So we change his regime, control his blood pressure well, start treating him aggressively with cholesterol medications. But again, every year treadmill, told normal, don't worry. Disaster waiting to happen. Then we have the opposite. I have actually this lady, 62, she's actually a mother of a GP, and her cholesterol is very high. And so they keep treating her with cholesterol medicines, and this poor lady keeps getting pain everywhere. She has muscle aches, she has all kinds of aches with it. She's one of those people very sensitive to cholesterol medicines, which is unusual. So don't get the wrong impression that cholesterol medicines are bad. It's very unusual for people to get such bad side effects. But this poor lady was living with it. Now, she has a family history of high cholesterol, but no one in the family got heart disease or stroke. But you look at her arteries, this is 62, this is pristine, and her calcium score was 0. So I said to her, well, your numbers are high, but so far so good. Maybe you shouldn't kill yourself trying to take the medicine, doing more harm than good. So it works both ways. In other words, trying to use risk profiling, most of the time we're correct. If somebody smokes, somebody's got high cholesterol, somebody's got high blood pressure, most likely they're going to have disease, but it's not always the case. Similarly, the young, fit 35-year-old with nothing wrong with him doesn't mean that he won't die from a heart attack. So sometimes we miss things out, and that's the whole point of imaging. It's not to replace traditional approach to ask you whether your blood pressure is high, whether your cholesterol is high, but rather it can be added onto what we know already. And then very quickly, there's a space, Star Wars kind of things, is gene testing. I'm proud to say that in Singapore, there's a research going on at the National University, and we are probably going to be the first people to have a comprehensive test for genetics so that even as a baby, you can swab the baby's mouth and tell what the risk of heart disease will be. These are some of the tests that we've done for our local patients. Don't want to go too much into it, but basically using this kind of charts, we can actually estimate your lifetime risk of getting heart disease. And if I'm not mistaken, I think Spring Singapore is going to be sponsoring them, so it's going to go commercial soon. It should be available pretty soon. So, final thoughts. There's traditional, the standard things, measure your blood pressure, know your cholesterol, are you overweight, are you diabetic, things like that, do you smoke. Very cost effective, well proven. Problem is some people get misclassified as being high risk when they're not, or low risk when they're not. So the modern innovation, I would say, is through imaging, actually looking at the artery itself. No matter what your risk factors are, if your artery looks terrible, you need treatment. No matter, on the other hand, if you are smoking and your arteries look beautiful, you should still stop smoking because you can get cancer and die. Okay, but the whole point being that we don't want to miss people out. Okay, but the problem is that these new technologies are very new, so we don't really know. We know they're accurate, but should we use it as a way of giving people medicine? For example, if your cholesterol is very low, but yet your artery looks terrible, we think you should take cholesterol-lowering medication, but has it been proven? Only 20, 30 years down the road we will know. But if you are the owner of a lousy artery, you probably can't wait 20, 30 years to find out the answer. And so therefore, we often discuss our patients and we do treat people early. Early prevention is better than cure or sudden heart attack. So with that, I'll end my talk, and thank you very much.